Hello there. I'm Dr. William Harris. Did you know that prostate cancer is one of the most common types of cancer in men, yet it often goes undetected until it's already in an advanced stage? The reason is quite simple. Many of the early warning signs of this condition are overlooked because they're easily mistaken for minor issues like mild inflammation, aging, or just plain fatigue. And in today's video, I'll help you recognize 12 early signs that may actually be the body's way of trying to warn you. Signs that most people ignore until it's too late. Please stay with me until the end of the video, because in the final part, I'll be sharing one of the most discreet and most frequently missed symptoms that holds immense diagnostic value. It's something that many doctors don't clearly mention during routine checkups. Before we begin this journey together, may I get to know you just a little? What's your name? And where in the world are you watching this video from? I'd be genuinely happy to know who I'm accompanying today in this video, so don't hesitate to leave a comment. If this is your first time visiting the channel, please hit that subscribe button and turn on the notification bell so you won't miss out on upcoming videos. And if you have any questions related to health, whether it's something you're currently experiencing or just a topic you're curious about, feel free to leave it in the comments below. I'll gather those questions and answer them in future videos. Now let's begin with the first symptom, and it's actually one of the most common, yet most frequently underestimated. Symptom 1, a burning or painful sensation while urinating, just irritation or something more serious. One of the earliest signs that many men experience, yet often dismiss, is a burning, stinging, or painful feeling during urination. Most people assume it's just a mild infection or due to not drinking enough water, and they often choose to wait it out. But the truth is, painful urination isn't only a symptom of urinary tract infections or benign prostate. Then in some cases, it can actually be an early sign of prostate cancer. As a tumor begins to develop in the prostate, it can press against the urethra, the tube that carries urine from the bladder out of the body, disrupting the flow and creating a sharp or burning pain. This discomfort may come and go or persist for days and is frequently mistaken for infection. This discomfort may come and go or persist for days and is frequently mistaken for infection. Here's the critical point. If the pain occurs without fever or other signs of acute inflammation, then it might not be a simple infection. Delaying a checkup, even for just a few weeks, could mean missing the golden window for early detection and effective treatment. So if you're experiencing a persistent, unexplained burning sensation while urinating, don't brush it off. Next, we'll explore a symptom that may seem quite ordinary, but can actually reveal a lot about what's happening inside your prostate. My friend, if you're still watching at this point, I'm truly glad to know you care about your health. Please leave a quick message in the comments below to let me know you're still here with me on this journey. Symptom 2, frequent urination, especially during the night. If you find yourself waking up 2, 3, even 4 times a night just to urinate, that's not something to take lightly. Frequent nighttime urination is one of the most common signs related to the prostate, but it's often blamed on harmless causes like drinking too much water in the evening, aging, or insomnia. However, here's an important fact. When the prostate starts to enlarge or develop a tumor, it can press against the neck of the bladder, reducing its ability to hold urine and creating the sensation of needing to urinate constantly. Even if the bladder isn't full, in the early stages, you may not feel any pain, and there may be no other unusual signs, just the inconvenience of waking up at night. But if this happens repeatedly night after night and starts affecting your sleep quality, it's not just a matter of getting older, it's a message your body is trying to send you, and it's one you should listen to. Some people may dismiss this symptom, but if you pay close attention, the next sign is even more subtle, not about frequency, but about how your body starts the process of urinating. Now, symptom 3, difficulty starting urination when your body needs to wait for permission. This is one of those quiet symptoms that's easy to notice. If you're paying attention, it means you feel the need to urinate. But once you're in the bathroom, it takes time before the stream actually begins. Sure, this isn't uncommon, especially in older men. However, if it starts happening regularly, it may be an early warning sign that something is blocking the urinary system, most often due to the prostate beginning to grow or undergo structural changes. As the prostate becomes abnormally enlarged, it can put pressure on the upper part of the urethra, narrowing the pathway for urine. The result is that your body has to push harder to overcome the blockage, and it takes longer for the urine to start flowing. Although this condition may be caused by non-cancerous issues like benign prostatic hyperplasia, if it occurs alongside other signs like frequent nighttime urination, a weak stream, or a sensation of incomplete emptying, then it's something you shouldn't ignore. In the next part, we'll explore a different kind of change, not in how you begin urinating, but in the strength and consistency of your urine stream, something many people only notice when it's already become quite pronounced. My friend, if you're still watching at this point, thank you for staying with me all the way through. I truly appreciate your time and attention. Feel free to drop a quick comment below, just so I know I'm not speaking alone on this journey. Symptom for a week or dribbling your own stream when the pressure isn't what it used to be. If you've noticed that your urine stream isn't as strong as it used to be, or that sometimes it doesn't flow steadily, but dribbles out slowly, this may be a sign that something is obstructing the flow of urine from the bladder. A weak stream often results from narrowing of the urethra, the tube that runs through the prostate. When this gland becomes enlarged or when abnormal tissue develops, it can squeeze the urethra, making it harder for urine to pass through with force. Many people overlook this symptom, assuming it's just a sign of getting older. But if it happens alongside other issues like frequent urination at night, trouble starting the stream, or feeling like the bladder doesn't empty completely, it could be an early indication of a more serious problem within the prostate. But that's not the whole picture. The next symptom is often misunderstood as incomplete urination, while in fact, the underlying mechanism is something entirely different that most people never suspect. Symptom 5, inability to urinate while standing, when the flow is unnaturally blocked. Here's another sign that often goes unnoticed, but is quite distinctive. The inability to urinate while standing, even when your bladder feels full and the urge is strong. Now, this isn't just a matter of habit or psychology. It may actually reflect a mechanical blockage in the lower urinary tract. In cases where the prostate is enlarged or there is abnormal tissue growth, the urethra can become compressed to the point that the flow of urine is interrupted entirely, or unable to start in a standing position, which is the typical posture for men. Many choose to sit to urinate out of convenience, unaware that this subtle shift may signal a clinically meaningful functional change. If you find that you need to change positions in order to urinate, or that you feel stuck trying to go while standing, it's a sign that deserves serious attention. This could indicate that a mass within the prostate is significantly affecting your body's ability to urinate naturally. Next, we're moving on to a symptom that tends to cause more alarm and fear than most because it involves the presence of blood in the urine or semen. Symptom, blood in urine or semen, a warning sign you should never ignore. Noticing blood in your urine or semen is understandably alarming, and rightfully so. This is a serious sign that requires immediate medical evaluation. In cases of prostate cancer, the presence of blood may be due to tiny blood vessels inside the prostate tissue being invaded or damaged. As a result, blood can easily leak into the urinary or reproductive systems, especially during urination or ejaculation. This condition sometimes presents without pain, or it may occur briefly and then disappear, making it easy to dismiss. However, No matter how much blood appears and whether it's persistent or not, it is always an abnormal sign that needs to be addressed. Delaying a checkup could mean missing the opportunity for early detection, especially if the bleeding stems from a malignant lesion developing silently inside the prostate. Now let's move on to a symptom that's just as sensitive when intimacy no longer brings pleasure, but instead causes pain. Each time you ejaculate. Symptom 7, pain during ejaculation, when pleasure is replaced by discomfort. Ejaculation is usually a process associated with satisfaction and relief. But if you begin to experience pain or a burning sensation during or after ejaculation, that's a clear sign something is going wrong in the reproductive system, and it should never be ignored. In many cases, this sensation is confused with ordinary inflammation. However, when the prostate is involved, especially if there's internal tissue damage, the act of releasing semen can trigger irritation or pressure on inflamed or altered areas, resulting in pain. The discomfort may be fleeting, or it may linger and extend to the perineum, or even feel like a tingling or prickling in the scrotum. Though subtle, if this feeling repeats over time, it's a warning your body is trying to give you, particularly when it appears alongside other unusual symptoms mentioned earlier. Continuing on this journey, you're about to discover a symptom that may seem unrelated to the prostate, yet it's one of the most common and quietly persistent signs in men dealing with serious sexual health issues. If you're still watching at this point, thank you for staying with me all the way through. I truly appreciate it. Let's keep going together until the very end of this important video. Symptom 8. Erectile dysfunction occurs when erections are no longer stable like before. Erectile dysfunction is a condition many middle-aged men face, but not everyone fully understands the underlying causes. If you notice that you're having difficulty maintaining or achieving a firm enough erection for intercourse, then aside from common factors like stress, cardiovascular issues, or hormones, you should pay special attention to your prostate. The prostate is closely linked to the nerves and blood vessels in the pelvic region, systems that are crucial for erectile function. When structural abnormalities occur in the prostate, such as the presence of cancerous tissue, it can indirectly affect blood flow or nerve signals to the penis, making it harder to get or maintain an erection. In addition, some patients may experience reduced libido, loss of morning erections, or weak ejaculation. All subtle signs that something may be changing deeper within the reproductive system, but there's another symptom that doesn't appear in the pelvic area, and yet it shows up frequently when prostate cancer begins to spread. And it's often mistaken for ordinary back pain. Symptom 9, lower back pain, hip pain, or pelvic pain when it's not just about aging. Dull aches in the lower back, both sides of the hips, or radiating into the pelvic area can result from many things like spinal degeneration, poor posture, or aging. But if this pain lingers without clear cause, doesn't improve with rest, or doesn't respond to over-the-counter medication, it may point to something more serious. The spread of cancerous lesions from the prostate to nearby tissues. In advanced stages, prostate cancer can extend beyond the gland and affect nearby bones, especially the spine, pelvis, and hips. This leads to deep, persistent pain, sometimes radiating into the legs or buttocks. Notably, many patients first report chronic back pain without realizing the source may be the reproductive system. If your pain isn't clearly related to movement or posture, and especially if it's accompanied by urinary symptoms, then this is the time to seriously consider getting a full medical evaluation. Up next, you'll learn about a symptom that doesn't involve pain, but gradually weakens the body, and maybe a sign that something dangerous is progressing silently. Symptom 10, swelling, numbness, or weakness in the legs. When the real issue isn't in your legs at all, when one or both legs begin to swell, feel heavy, numb, or unusually weak, many people assume it's a problem with circulation, joints, or the sciatic nerve. However, In some cases, this may be an indirect result of advanced prostate cancer. This can occur when tumors compress the lymphatic or nervous systems in the pelvic region. As the tumor spreads, it may affect major blood vessels or lymph nodes in the hips and pelvis, blocking fluid circulation and leading to leg swelling. At the same time, if nerves are compressed, numbness or muscle weakness can occur, especially in the back of the thighs or calves. These symptoms tend to develop slowly and are often misattributed to other conditions. But if you experience unexplained leg swelling or numbness, especially alongside urinary symptoms or pelvic discomfort, this is a warning sign that should not be ignored. To continue our journey, we'll now move to one of the most easily overlooked changes, when your body gradually weakens without any clear reason and things only become obvious when it's already late. Symptom 11, persistent fatigue and unexplained weight loss, when the body is signaling something deeper. If you find yourself constantly low on energy, even with enough sleep and proper nutrition, and you still feel exhausted and drained, this isn't just the result of life pressure or aging. So this comes with unexplained weight loss. Your body may be dealing with something more serious. And one of the potential hidden causes is the silent presence of cancer. As prostate cancer progresses, it can interfere with the body's metabolism and reduce nutrient absorption. On top of that, the immune system has to work harder to fight off abnormal cells, resulting in continuous energy depletion. The outcome is gradual weight loss, a pale complexion, and noticeable mental fatigue. Since these symptoms come on slowly and don't cause pain, they're easy to miss. But even gradual changes in physical condition should be a red flag, especially if combined with any urinary symptoms discussed earlier. And now we come to the final symptom, one that's less common, but a powerful warning that cancer has reached the stage of affecting nerve function and bodily control. Symptom 12, neurological dysfunction, when bowel and bladder control begin to fail. In later stages, prostate cancer can spread and affect the nerves responsible for controlling the lower pelvis, leading to disorders that at first may not seem related to the prostate. One of the most concerning signs is loss of bladder or bowel control, or numbness in the buttocks, inner thighs, and perineum. These symptoms suggest cancer may have reached the spinal cord or peripheral nervous system, and this is one of the clearest indications that the disease has advanced significantly. Some may also experience prolonged constipation, bowel irregularities, or an inability to urinate even when the bladder is full, due to disrupted signals between the brain and the body's elimination system. Although this is a rare symptom, if it does appear, it requires immediate medical attention, as the risk of permanent nerve damage is extremely high. We've now gone through 12 important signs, subtle but extremely critical, that are often overlooked. But before you leave this video, please stay a little longer, because there's something I need to say that you truly shouldn't miss. Don't ignore these signs, because timing is everything. We've just gone through 12 early warning signs that may be linked to prostate cancer, signs that many people ignore or downplay, thinking they're just part of getting older or not a big deal. Now, but as you've seen, even the smallest changes, from a weak ear and stream to numbness in the legs or chronic fatigue, could be the body's first warning of something much more serious. Here's the most important thing. The earlier it's detected, the better the chance of successful treatment. In many cases, prostate cancer progresses slowly and silently, and that gives you a real opportunity to act early if it's diagnosed in time. If you or someone you care about is experiencing 2 or more of these symptoms, please don't delay. Seeing a doctor, doing a few simple tests like a PSA blood test, an ultrasound, or a digital rectal exam could clarify what's going on and rule out more serious risks. And finally, I want to share a message, not as a doctor, but as someone who has witnessed far too many moments of I wish I had known sooner. I've met so many patients, fathers, husbands, brothers, who once thought, I'm fine. Well, it's just fatigue. It's probably nothing serious. And then one day, they faced an unexpected diagnosis, not because the disease was too aggressive, but because they ignored the early signs. I don't say this to scare you. I say this so you understand that listening to your body, getting regular checkups, and not brushing off unusual symptoms, that's how you protect yourself and the people who love you. Prostate cancer is not a death sentence if it's caught early, but your silence, your hesitation, your discomfort in speaking up, that could make things harder than they need to be. I hope this video has helped you realize something valuable for yourself. And if it has, then the time you've just spent watching was absolutely worth it. If you found today's video helpful, please subscribe to the channel and turn on the notification bell so you won't miss any future videos on men's health and evidence-based guidance from a medical perspective. This channel is here to walk with you to help you understand your body better, detect the silent changes early, and maintain quality of life in a proactive, healthy, and informed way. Thank you for staying with me until the very end, wishing you good health, peace, and abundant positive energy in your life. See you in the next video.